Hi everyone, this is Dr. Bill with EZ2PASSNCLEX, EZ2PASSNCLEX.com. In this session, I'm going to be reviewing intracranial pressure, mainly increased intracranial pressure. So what is it, or what do we say when we mean by increased intracranial pressure? Mainly, it's a growing pressure around the brain or in the skull. It can be caused by infection, trauma, meningitis, which is one of the infections that can increase intracranial pressure. It can also be caused by blood vessel diseases such as coronary artery diseases. It can be exacerbated by smoking, high cholesterol, and also stroke or hypertension. Okay, so those are some risk factors that can predispose or exacerbate increased intracranial pressure, and also hydrocephalus, mainly water or fluids accumulation around the brain. So what are some priority assessments or assessments that you're going to be identifying with a client who has been diagnosed with increased intracranial pressure? These include headache. It's a classic symptom for increased ICP, also known as increased intracranial pressure. You're going to see triad. Basically, the patient is going to have increased systolic blood pressure, mainly, or some may describe it as increased blood pressure, which with the focus on systolic blood pressure. There's going to be decrease in heart rate, known as bradycardia, and respiration will also be decreased, bradypnea, or some irregular respirations will be associated. Nausea, vomiting, pain that is sometimes in the head, okay, which mainly can be described as headache, and it can lead to seizures. So you need to look out for and implement your seizure precautions when we get to the nursing interventions. This client will be fatigued and may have some decreased motor functions, as well as changes in motor or neural functions. So what are some priority interventions for this client as far as nursing concerned? You want to implement your safety precautions because we are concerned for seizures in increased intracranial pressure. Position the client with the bed at least 30 degrees or higher because that helps with the gravity or helps reduces the blood pressure that's going into the brain. So elevate the head of the bed. Also make sure that the client is or ready to receive osmotic diuretic known as mannitol. Okay, mannitol is a common medication that they give in the clients with increased intracranial pressure. Some diuretics such as furosemide can be given to help reduce any pressure in the brain through reduction of fluid accumulation. Monitor signs of neurovascular changes, and this will be identified through your Glasgow Coma scale. You want to assess your Glasgow Coma scale for your client and monitor or tightly control the client's blood pressures with some medications. Okay. Now, you want to also ensure that the client is not engaging in any activities that will exacerbate or increase the pressure, such as, flexing or bending at the waist level. Changing or making neck or head adjustments that will affect also increased pressure. Even coughing, some basic activities such as coughing can also increase the pressure in the brain. So what are some diagnostic studies when it comes to increased intracranial pressure? You want to look out for neural assessments, CT, MRI can all be done. And also lumbar puncture when it's not in acute phases, for the client diagnostic phase. Okay, a lumbar puncture can be done, but not in acute phase because that can exacerbate the increased intracranial pressure. So some nursing education for these clients include avoiding bending or engaging in any activities, strenuous activities that will increase the pressure. Weight management or weight loss. Watch out for diet, alcohol. They need to reduce alcohol intake, avoid smoking, and also refer or defer them to activities or support groups that will help them with alcohol and smoking cessation. And also note that some clients may be prescribed some steroids, so they need to comply and not stop taking the steroids abruptly. Steroids must always be tapered off so they don't go through withdrawal, okay? And also follow-up. And that it is for increased intracranial pressure. Follow my channels for other videos. And thank you. Easy to pass with Dr. Bill.